You wake up at 2 a.m., then again at 4, maybe even 5:30, and every single time it's the same thing. You need to pee. Again, you're exhausted. You've tried drinking less water. You've tried cutting off fluids after dinner. Nothing seems to work. And the worst part? Most people assume this is just part of getting older, something you have to live with. But here's what almost nobody tells you. For a huge percentage of people, the real cause of waking up to pee at night has almost nothing to do with your bladder. It has to do with your legs. And once you understand the mechanism behind it, you can start fixing it tonight. Stay with me, because in the next few minutes, I'm going to walk you through exactly what's happening inside your body, why the usual fixes fail, and what actually works. Let's get into it. During the day, when you're standing and sitting, gravity pulls fluid down into your lower legs and ankles. This is completely normal. But if you're not moving enough, if you eat a lot of salt, or if you have any degree of venous insufficiency, which is just weak veins struggling to push blood back up, that fluid pools in your legs and stays there. Now here's the critical part. The moment you lie down at night, gravity is no longer pulling that fluid down. It redistributes. It moves back into your bloodstream. Your kidneys detect the extra fluid volume and do exactly what kidneys are supposed to do. They produce urine to get rid of it. Except now it's 2 a.m. and your bladder is filling up whether you like it or not. That's why drinking less water doesn't fix it. The fluid is already in your body. It's just been hiding in your legs all day. Here's why this matters more than people realize. Every time you wake up to use the bathroom, your sleep cycle resets. You lose deep sleep. You lose REM sleep. Over time, that fragmented sleep leads to daytime fatigue, reduced focus, irritability, and in older adults, a significantly higher risk of falls, especially during those dark, half-asleep bathroom trips at night. Some studies even link severe nocturia to increased long-term health risks. This isn't just inconvenient, it is a quality-of-life issue worth solving. So the real fix isn't about your bladder. It's about getting that fluid out of your legs before you go to bed. Here's exactly how to do that. Fix number 1, leg elevation. This sounds almost too simple, but the science behind it is solid. When you elevate your legs above the level of your heart, heels higher than your chest, gravity starts working in your favor. The fluid that's spent all day pooling in your lower legs begins draining back into circulation. Your kidneys process and eliminate it during the evening, while you're still awake instead of at 2 a.m. Here's how to do it properly. About 1 to 2 hours before bed, lie on your back and raise your legs up against a wall. Slide your hips close, extend your legs straight up, and let gravity do the work. Stay there for at least 5 to 10 minutes. While you're there, add slow ankle pumps. Flex your feet toward you, then point them away. This activates your calf muscles, which act as a natural pump, squeezing the veins and pushing fluid upward toward the heart. Clinical studies have shown this combination reduces leg swelling, improves quality of life in nocturia patients, and in one study produced a near 180 milliliter reduction in overnight urine volume. That is a meaningful, measurable difference. Fix number 2, compression stockings during the day. This surprises people, but it works. Wearing knee-high compression stockings, 15 to 20 millimeters of mercury, a light to moderate level, while you're upright during the day physically prevents fluid from pooling in the lower legs in the first place. Less fluid pooled during the day means less fluid released at night. Less fluid at night means your kidneys aren't triggered to produce a surge of urine while you're sleeping. Research confirms this. Compression stockings combined with evening leg elevation can significantly reduce nighttime bathroom trips. It's low cost, requires no equipment beyond the stockings themselves, and works directly with your body's own circulation. Fix number 3, calf pump exercises. 1 hour before bed. Your calf muscles are sometimes called the peripheral heart. When they contract, they compress the deep veins in your lower legs and push blood and fluid upward. When you're sedentary all day, that pump barely activates and fluid accumulates. Here's a simple 10 to 15 minute routine to do about 1 to 1.5 hours before bed. Start with seated heel raises. Toes stay on the floor, lift your heels as high as you can, then lower slowly. 15 reps, 2 to 3 sets. Then ankle pumps. Flex and point your feet in a slow, So controlled motion 20 to 30 reps. Add gentle chair squats if your mobility allows. Stand in front of a sturdy chair, slowly lower as if you're about to sit. Stop just before you fully sit and push back up. 8 to 12 reps. Finish with foot rolling. Use a small ball or even a frozen water bottle and roll it slowly under each foot for 1 to 2 minutes. This stimulates lymphatic drainage in the feet and lower legs. 6-month structured calf exercise programs and clinical studies showed significant improvements in venous return, reduced fluid accumulation in the legs, and improved sleep quality. These are not strenuous. Anyone can do them. Fix number 4, double voiding. About 1 hour before you go to bed, go to the bathroom and urinate normally. Then, and this is the part most people skip, wait 20 to 30 seconds. Relax completely. Lean slightly forward to release tension around the bladder. Then try again. You'll often find there's more urine left. Do this again right before lights out. What you're doing is starting the night with the bladder as empty as possible. This is a proven behavioral technique urologists recommend specifically for reducing those small volume nighttime awakenings. The kind where you wake with urgency but barely produce anything. That urgency is often caused by residual urine tricking the bladder into signaling fullness before it actually is. Fix number 5, fluid and diet timing. Shift your drinking earlier in the day. Load your fluids in the morning and afternoon. Your body genuinely needs hydration, but taper sharply after 6 or 7 p.m. Avoid caffeine and alcohol in the evening. Both are diuretics. They actively increase urine production and make everything worse. Cut salty foods at dinner too. Sodium drives fluid retention during the day, feeding directly into the nighttime redistribution problem. If you take diuretics, water pills, for blood pressure or heart conditions, ask your doctor about adjusting the timing. Taking them at least 6 hours before bed allows the peak effect to happen while you're still awake. Fix number 6, daily walking. 30 minutes of brisk walking during the day keeps circulation active, prevents fluid from pooling in the legs, and improves overall sleep quality. An 8-week evening walking program in one study significantly reduced nocturia frequency in older adults. You don't need a gym, you need consistent movement. That alone changes the fluid dynamics in your lower body over time. Now, here's the one insight that ties all of this together. Most people treat nocturia as a bladder problem and wait for it to get bad enough to see a doctor. But the most common driver, especially after age 50 or 60, is a mechanical, fixable fluid issue that starts in your legs at 9 a.m. and doesn't hit you until 2 a.m. Compression during the day, leg elevation and calf pump exercises in the evening, double voiding before bed, fluid timing, and reduced salt. That is the full system. Many people go from 2 to 4 nighttime bathroom trips down to 0 or 1 within days of applying this consistently, when fluid redistribution is the primary driver. One more tool worth using, a voiding diary. 3 days. Write down every time you drink something and roughly how much. Write down every time you urinate, what time, and how much. Note nighttime awakenings. This simple log, recommended by international urology guidelines as the cornerstone of proper nocturia diagnosis, tells you and any doctor you see exactly what's driving your situation. Most people never do it, the ones who do get answers fast. If you try these strategies consistently for 2 to 3 weeks and still wake frequently, or if you notice blood in your urine, pain, significant leg swelling, or sudden changes, see a doctor. Underlying causes like sleep apnea, prostate issues, diabetes, or heart conditions sometimes need proper evaluation and treatment. These fixes are not a substitute for that. They are the intelligent first step. But for most people watching this, the answer is simpler than they ever expected. And it starts with your legs, not your bladder. If this gave you something genuinely useful, subscribe. We cover practical, evidence-based health content that respects your time and your sleep.